Hi, I'm John Strum, and this past fall, I attended ECTRIMS, the largest MS research conference in the world. During the conference, I had some quick conversations with some of the experts who were on hand to present their work to the more than 9,000 attendees. In a moment, we're going to see one of those conversations. And then you'll hear from some folks who are living with MS who are going to share their perspectives on the topics we discuss. I'm at ECTRIMS 2023 in Milan, and I'm speaking with Dr. Annette Langer-Gould, an MS specialist who's co-chairing a session here at ECTRIMS on MS and comorbidities. Dr. Langer-Gould has joined me on the podcast before, but I don't often get to see her in person, so it's very nice to see you.
Nice to see you again, John. Thank you so much for inviting me.
Sure. You know, if I have my definitions right, and I hope I do, comorbidities are other health conditions that someone living with MS might also have. Is that it?
That's correct.
So does having MS make someone more susceptible to developing a comorbid condition?
Yes, most definitely the rates of anxiety and depression are considerably higher in people with MS than age-matched controls. And also migraine seems to be far more common starting around the time of the onset of the MS in people with multiple sclerosis.
What are some examples of common comorbidities among people with MS?
So it depends on age, but anxiety, depression, migraine, and cardiovascular diseases as they age, and COPD. So smoking is a risk factor for MS, so not too terribly surprisingly, they also have a higher risk of COPD.
Besides having their own impact on a person's health, can comorbidities make that person's MS worse?
Yes, definitely. Both anxiety and depression seem to be associated with worsening disability progression and higher and vascular risk factors with higher relapse rates. Exactly how they do it is unclear. It's certainly possible that anxiety and depression they decrease adherence with medications that need to be taken regularly. And we heard a really nice talk at our session today talking about problems with compliance, both with injectables and fingolimod in people with anxiety and depression and their MS.
That's interesting. Is age a factor in developing comorbidities?
What do you think? I was a lot healthier when I was in my 20s, that's for sure. So absolutely, yes. People get more comorbidities as they age, and MS is no exception. And the big ones in terms of impacting MS outcomes or EDSS scores, disability scores, are cardiovascular comorbidities and also diabetes. So you can imagine if you have MS and now you get a diabetic neuropathy, your balance is going to be off even more than if you had not developed the diabetic neuropathy.
That's interesting. I can imagine that someone living with MS, when a different symptom develops, I think their go-to explanation to themselves is, oh, it's my MS. But in fact, it doesn't necessarily mean it is.
That's correct. We always have to be vigilant, particularly in our patients who are not in the best health, this may not be an MS relapse. This may actually be a stroke that they're having.
So if you're being treated by a physician for a comorbidity, it seems really important that the physician and your neurologist are talking to each other so that your MS specialist, your neurologist, understands all the treatment you're receiving so that everybody is clear on what's being prescribed and it can all work together. It seems important.
Definitely. Absolutely. We do it in the form of an electronic health record so we can see each other's notes, and we also can send each other messages through the electronic health record. And we can also look at their labs and say whether or not their hemoglobin A1C is controlled or whether their lipids are under control. And I think it's a really important role for neurologists to emphasize with their MS patients that they also need to be managing their comorbidities. Sometimes our patients get really, they really sort of get hung up on the DMTs and their MS has been stable for years, or they have slowly progressive MS, which the DMTs don't really help with anyway. And they use that as that uses up a lot of their mental energy, so they're not paying attention to doing a better job controlling their lipids, their blood pressure, and their blood sugars.
I'm glad you mentioned the fact that MS can use up a lot of their energy. Just living with MS alone does really use up a lot of someone's personal bandwidth, I guess I'll call it. So I'm wondering, has there been any research done on how comorbidities might affect a person's mood or their emotional well-being?
Not that I'm aware of. It's a pretty tricky study to do because the rate of depression and anxiety are already so high. We did just see one presentation from Dr. Alfredsson in Sweden showing that obesity not only increases the risk of disability accumulation, but also increases the risk of cognitive impairment over a 15-year period. So.
Dr. Annette Langer-Gould, thank you for all you do to improve the lives of people who are living with MS. Thanks again for talking with me today.
Thank you so much for having me. I really appreciate it.
I'm John Strum, and this Real Talk MS ECTRIMS Extra is made possible through a grant from Sanofi. We've just watched my conversation with Dr. Annette Langer-Gould, and joining me to provide some perspective from people who are living with MS are Demika Cavalier and Laura Kulikowski. Demika, Laura, welcome.
Thanks, John.
Thank you.
Demika, when were you diagnosed with MS?
I was diagnosed in October of 2019.
You just heard Dr. Langer-Gould talk about living with MS and dealing with comorbidities or other health conditions. Without getting specific, since you were diagnosed with MS, have you been diagnosed with any comorbidities?
Yes, I have.
Let me ask you then, has that made managing your MS more complicated?
Of course, it's added more doctor's visits to the already hectic schedule of having visits with my neurologist and my primary care provider. So now I actually see another specialist because I was diagnosed with another autoimmune disease. And initially, I thought that it was my MS getting worse, but it ended up being another condition altogether.
I think that's something that Dr. Langer-Gould pointed out in my conversation with her, how very often when someone living with MS sees a new symptom pop up, they think, well, that must be my MS. And so it delays treatment of whatever that new condition might be. And sometimes that can be a really long time. I'm glad you got ahead of that.
Initially, that was my thought, that it was my MS getting worse. And so, of course, I went to my neurologist. And there was a slight delay because she ordered some labs. And initially her thoughts was that, everything was okay. It wasn't until I saw my primary care doctor that she questioned those labs. It was like, no, I think you need to see a rheumatologist. And so it was then that I got that secondary diagnosis.
I can see someone who's already dealing with managing their MS. They have their disease modifying therapy, maybe some additional symptom management medications, and now there's a whole other health condition to think about and manage. It seems like a lot, doesn't it?
It really is. It's a lot, but you have to advocate for yourself and just listen to your body and know that if something's not right, to just seek the care that you need. And even if initially, your physician is telling you that it's okay, your body, so you just know to just take the necessary steps to get the treatment that you need.
I think anytime anybody advocates on behalf of their own interests, it's such an empowering process, especially when it turns out like it did in your case. The fact that you followed up in spite of what you initially heard, as you pointed out, you know your body. It really made a difference and helped get this second condition under control sooner, I'd imagine.
Yes, right.
Laura, can you tell us when you were diagnosed with MS?
Sure, John. I was diagnosed in 2008, and interestingly, my MS diagnosis was a comorbidity that was added on to another chronic condition, which had been diagnosed earlier in the year, which was cardiovascular, which Dr. Langer-Gould touched on in her talk of that comorbidity. So I first had the cardiovascular problems, and then I was diagnosed with MS because, like D'Amica said, I knew something else was wrong. And it sent us down that trail of searching what is going on till eventually I was diagnosed a few months later with the MS.
Living with MS and one or more comorbidities requires real coordination between a person's neurologist or MS specialist and the healthcare professional who's treating them for their other health condition. Or in your case, Laura, it was exactly the other way around. Do you see that sort of cross communication between healthcare professionals as something that's well coordinated?
Yeah, John, I always have looked at my medical care and treatment as needing a team approach, with myself being the team captain, of course, that I'm directing the team, but very closely as my co captain is my primary care physician, who we talk extensively about my treatment for the other comorbidities going on and her willingness to communicate with the other doctors. I have another example, though, of a comorbidity that I had an issue with, a physical problem that everyone attributed to my MS because of the pain and the spasticity and the restlessness and the discomfort. And physical therapy didn't correct it, and this didn't correct it, and that didn't correct it. And it ended up being that I needed a hip replacement for osteoarthritis. And I spent 3 years chasing an MS cure, a cure for that MS problem, which was not MS at all. And in the process, my neurologist and the surgeon actually had in depth conversations about the DMT that I was on at the time and how it might complicate my healing process from surgery. And so, you've got to be able to talk about this cross channeling between specialists and your primary care physician and the person themselves with MS to be sure that this talking is taking place. And I think it's really important, like D'Amica pointed out, that empowering of being responsible for yourself and your treatment, because you can't just sit back and hope that the doctors are doing the right thing and talking to each other, and as opposed to making sure they have that contact information or they know those points of discussion that they need to talk to each other about before we proceed with my care in a particular area.
Dr. Langer Gould made the point that someone living with MS can be really focused on adhering to their disease modifying therapy, but can sometimes be less adherent when it comes to the medication required to manage their comorbid condition. And I think, as D'Amica pointed out, managing multiple health conditions can get complicated. Laura, is there anything you can think of that would make the whole process easier for the person living with MS?
I think the most important thing is keeping a record, writing things down, because we really think our memory is good. But hey, folks, we got MS, and that's a cognitive disease to begin with. And we have busy lives. That's another complication. So I think it's really important to write things down as you think of it in the moment and keeping that handy. So when you're having discussions with your treating doctor, whether it's your specialist or your primary care folks, you have a solid reference of items to discuss and dates and times of episodes or things that may have happened that you need to review with them. Because juggling comorbidities, it sounds really simple. Oh, you've got this and you've got this. But, it just ends up in one big muddied mess, one big jumbled ball of stuff. And by writing it down, you're able to present everything on that platter of, here's this mess I have. Now help me deconstruct it into pieces and whose category it fits into. I think that's really important, keeping a written record of what you experience as your days go by.
D'Amica, how about you? What do you think might make the process of managing comorbid conditions a little bit easier for someone living with MS?
So I use a schedule for taking my medications, and also for tracking everything. I have an app that I use to track my symptoms and how they change, because that helps me to manage it, in addition to writing things down, as Laura mentioned.
So, D'Amica, let me ask you, is your app specific to MS, or is it something that you can keep all your symptoms in?
It's something that I can keep everything in.
Laura Kolakowski, D'Amica Cavalier, thank you both for spending a few minutes talking with me today.
My pleasure. Thanks for having us, John.
Thanks for watching. If you'd like to hear more about the amazing MS research that's taking place in laboratories all around the world, I hope you'll join me every week for the Real Talk MS podcast.